Dear healthcare professionals and my dear viewers, welcome to Healthcare Engineering channel. I'm R. Surya alias Kritika, a biomedical engineer from Healthcare Engineering team. I'm so glad that our team have an opportunity to have a presentation like this, and I always like to share the knowledge and experiences what I gain from the industry with you all, and this makes me and our team to create such an amazing and knowledgeable presentations like this. I strongly believe that all kinds of healthcare professionals and students can learn a lot from our channel and blog to update their knowledge by knowing the trendings in modern healthcare world. Therefore, I would like to welcome you all to subscribe our YouTube channel and press the bell icon to get the notification instantly once we post our informative video. And also you can visit our blog www.learnbiomedengine.blogspot.com. You learn more on the concepts we share in our videos. We can advertise your healthcare products, we can promote your healthcare events, we provide supports to boost up your healthcare business, we can provide technical reviews for your medical devices and many more online supports. If you are interested to get the support from us, please contact us to our email ID which will be shown in your screen. Healthcare engineering team also active in these social media platforms. If you want to get more updates regarding healthcare, you can follow any one of the platform or all of these. And also if you are healthcare professional who wanted to give information regarding healthcare sector, you can utilize our WhatsApp group to share your thoughts. All the blog links and also the social media platform links are given below in the description box. Today, in this presentation, we are going to see a topic that related to biomedical device, which is nothing but colonoscope. First of all, what is colonoscope? Colonoscope is a thin flexible equipment which is designed to examine the entire colon and terminal ileum with the help of the camera. Colonoscopy. Colonoscopy is an examination to inspect the inner lining of the large bowel, that is rectum and colon. For polyps, polyps is nothing but a lumps inside your colon that can turn into cancer. Using a thin flexible tube called colonoscope with a camera at its tip. It is inserted via the anus and gently guided to start the large bowel, and also it is possible to enter and examine the few inches of the small intestine, that is the terminal ileum. Colonoscopy can detect inflamed tissues, ulcers, and abnormal growths, and commonly used to evaluate gastrointestinal symptoms. This procedure is used to look for early signs and also acts as a screening test for colon cancer. Investigate abnormal pain, rectal bleeding, and chronic constipation and diarrhea. Types of colonoscopy. There are mainly two types of colonoscopy. One is screening colonoscopy and another one is diagnostic colonoscopy. Screening colonoscopy. Screening colonoscopy is nothing but it is similar to flexible sigmoidoscopy, except the doctor uses longer, thin, flexible light tube to check for polyps inside rectum and entire colon. Diagnostic colonoscopy. Diagnostic colonoscopy is performed on a patient who has gastrointestinal symptoms, for example, rectal bleeding, etc. Next, we are going to discuss about why colonoscopy is done. The doctor may recommend a colonoscopy for upcoming reasons. To investigate intestinal signs and symptoms. A colonoscopy can help your doctor explore possible causes of the abdominal pain, blood in rectal, chronic constipation, severe diarrhea, and some other related problems. Screen for colon cancer. If you cross the age of 50 and above, you have the maximum risk for the colon cancer. Sometimes the symptoms may not show you properly on the time. For every 5 to 10 years, you have recommended to take colonoscopy. Look for more polyps. If you have polyps already, your doctor may recommend a follow-up colonoscopy to look for and remove any additional polyps. This is done to reduce your risk of colon cancer. These are the main reasons for why we done colonoscopy. Next, we are going to see components of colonoscope. Control section. Control section, it provides distal and bending section. Instrument channel. Instrument channel is present in the colonoscope, in which it has forceps, snare, injector and clip device. Object lens, light guide, water jet nozzle, working channel. Colonoscopes have several hollow channels for suction, water and air delivery for the purpose of insertion of the accessory instruments. The light guide is for better viewing. A tip, which is nothing but the distal end of the shaft, control from the control section. It includes a charge coupled device that serves as a small camera and electronically transmits the image from CCD to external video processing unit and the connection section online. This is the main components that present in colonoscope. Preparations needed before colonoscopy. Before the colonoscopy, some preparing procedures are there for the patients who undergo colonoscopy. This process is known as bowel prep. Generally, the solids must be emptied from a gastrointestinal tract. Whether they follow a special diet the day before the exam, of course they don't eat any foods, they have a liquid diet for 1 or 3 days before. That is, any solid foods the day before the colonoscopy. Limited clear liquid items only consumed, such as water, tea, black coffee, that is without milk, broth and carbonated beverages. They don't allow you to eat flavored, colored or red dye beverages. Sometimes it may confuse with your blood. And also you can eat low fiber food, no whole grains, nuts or seeds. Can I consume any blood thinner drugs? Most of the medications may be continued as usual, but the medications with the blood thinners such as warfarin, insulin, aspirin, arthritis medications and iron preparations or some medicine that need to be consulted with your doctor. Did I undergo any medical procedures or dental procedures? The doctor should be altered if in the past patients have required any antibiotics prior to surgical or dental procedure to prevent infection. Can I drive before this procedure? Driving is not permitted for 24 hours after colonoscopy to allow the sedative time to wear off. Before the procedure, the patient made some plan for riding from the home to hospital. Is there any preparation left? Yes. A laxative or an enema may be required the night before colonoscopy. A laxative is a medicine that loosens stool and increases bowel movements. This is usually swallowed in the form of a pill or as a powder that is dissolved in water. An enema is performed by flushing water or sometimes a mild soap solution into the anus using a special wash bottle. This is the preparation needed before colonoscopy procedure. Procedure during colonoscopy. Colonoscopy is a low safe procedure with low complication. The most significant risk is that it perforation the bowel. During a colonoscopy procedure, you will wear a gown. Sedation is usually recommended. Sometimes mild sedation is given to the pill form. In other cases, a sedative is combined with intravenous pain medication to minimize any discomfort. It feels the patient to be relaxed. During the examination, a patient lies on the left side on the examination table. The doctor and the medical staff monitor vital signs and attempt to make patients as possible. Usually, your knees were drawn towards your chest. The patient is continuously monitored for heart rate, rhythm, blood pressure and oxygen in the blood. The colonoscope, which is long enough, is reach your entire colon. It contains a light and tube that allows the doctor to pump air or carbon dioxide. Why CO2 gas is used is that it reduces the post-procedural pain into your colon. This air inflates the colon, which provides a better view of the lining of the colon. Once the tip of the colon or the last portion of the small intestine is reached, the colonoscope is slowly withdrawn and the lining of the colon is carefully examined. Colonoscope may often make you feel bloating and cramping in the abdomen area or the urge to have a bowel movement, but with the medication pain becomes infrequently causes severe pain and it is tolerated. The camera sends to an external monitor so that the doctor can study the inside of your colon. The colonoscopy usually takes 15 to 60 minutes. If the entire colon for some reason cannot be visualized, the physicians may decide to try colonoscopy again at later date with or without different bowel preparation, or may decide to order an X-ray or CT of the colon. The doctor can insert an instrument through the channel to take biopsy, that is, tissue sample, or remove polyps or other abnormal tissue. This is the procedure for colonoscopy. Next, we are going to discuss about the benefits of colonoscopy. Colonoscopy provides more clear and detailed information. Colonoscopy helps to detect early signs and colorectal cancer and allows your doctor to remove the polyps in time. It is also used to detect of diverticulitis. Over time, bacteria and food can build up inside the pockets of your intestines, leading to the painful inflammation and also the infection known as diverticulitis. These are the benefits of colonoscopy. Abnormalities detected during colonoscopy. If a colonoscopy is negative, that is, your doctor doesn't find any abnormalities in the colon during the procedure, they may recommend that you have another colonoscopy in the next 5 or 10 years. If the doctor finds positive after these years, that is, any abnormality during the procedure, in which it may detect any polyps, that is, based on the size and the polyps number, you may need to follow the rigorous surveillance of the future. It may be the cancerous polyps. Some certain characteristics of the polyps which indicate high risk possibilities of the colon cancer. If the polyps are larger than 0.4 inches. If you have a polyp or any other abnormal tissue that couldn't be removed during the colonoscopy, your doctor may recommend a repeat examination in the gastrointestinal tract specialist. The person who is special in gastrointestinal tract is known as a gastroenterologist, in which they remove the large polyps and also they undergo any surgery to removing these polyps. This is the image of abnormalities detected during colonoscopy. Risk and complications of colonoscopy. A colonoscopy poses few risks, and rare complications of the colonoscopy may include adverse reaction to the sedative used during the exam, bleeding from the site where the tissue sample, that is biopsy, was taken, or a polyp or other abnormal tissue was removed. A tear in the colon or rectum wall, that is perforation, can occur. Inflammation or infection of pouches in the colon known as diverticulitis. A severe problem in abnormal pain and problems in people with heart or blood vessel disease. Some complication can lead to blood transfusion, surgery, hospitalization, or rarely death. These are the risks and complications of colonoscopy. This is about today's presentation. Hope you can get some clear overview about colonoscope and colonoscopy and also its process. If you want to know more contents regarding colonoscope, kindly visit our blog www.learnbiomedengine.blogspot.com. And also, if you want support for your healthcare business, please approach us in below mail ID. If you like to receive update of a new video, please subscribe our YouTube channel and also comment your favorite topic or medical devices you can willing to learn. You can follow us in these social media sites to receive updates of healthcare engineering team. Thank you so much for watching.